So, why we need to discuss about sleep apnea and snoring? So, today we'll be seeing the importance of sleep apnea and snoring, why it is a common cause in a lot of population. So, today we have invited a special guest, Dr. Stella, ENT surgeon from Devdas Hospital, to provide us solution for all the queries that you have raised in our platform regarding sleep apnea and snoring. So let us welcome our special guest today.
Hi, good morning, Karthika.
Hi, ma'am. Good morning. How are you doing, ma'am?
I'm fine. How are you?
And I invite you with an immense pleasure to our live today to provide a solution for all our queries that has been raised by a lot of people on the topic of sleep apnea and snoring, ma'am.
Okay.
So, actually, ma'am, before starting, I would like to define the sleep apnea and snoring, why it is need to be discussed about snoring, and what is the life course of this snoring habit, and why do people snore in other our whole population. So only few are in the habit of snoring. So why it is very important, and what are the causes, and what is the life expectancy of this snoring, sleeping apnea and snoring, ma'am?
Okay. So, snoring, as we say, snoring means there is a noisy breathing which is coming from the nose and the mouth when we sleep. It is because of partial obstruction of the airway. It can either be through the nose or through the mouth. It has a lot of causes. I think subsequently we are going to discuss about the causes. And as you said earlier, snoring is a very common issue, which is exactly to be said as a health issue, but not many identify it as a very significant one, so they let go of it. We have to identify snoring in the early phase, rectify it so that we do not get into serious diseases or complications later on in life.
Okay, ma'am. So as you said, we have to define why it is important, the importance of snoring. So let us start with our session today, ma'am. So my first question would be, how can we stop snoring?
Okay, so snoring has a lot of causes. So snoring can be because of anything happening in the nose, in the throat, or if the person is a obese person. So these are the three general causes. In the nose, if there is any allergy, so there is the tissues in the nose, they become bigger, and then there is the passage for the air through the nose is reduced. Number one. And if the nose is a crooked nose, you say there is a deviation in the nose, then the airflow gets reduced because of the deviation, then that can happen. Then behind the nose, we have an area called nasopharynx. If something, a mass or something is sitting in the nasopharynx, then we can have snoring. The most common one is tonsils, as we all know, the tissues in the back of our throat. So if they are big, then obviously the air which is going to get inside also gets reduced, then snoring comes. And the fat externally in the neck and in the chin region can also give rise to snoring. So these are the causes. So how do we stop snoring? We have to address each one of these causes one by one. I would advise, if a person has snoring, then it is better to get checked in the earliest with an ENT surgeon, uh, with or without a pulmonologist, to get snoring sorted out before it reaches the sleep apnea phase and giving a lot of deleterious complications.
Okay, thank you, ma'am, for making us know that even the deviation in the nose can cause snoring. So I haven't heard before that. And so my next question would be, ma'am, what is the main cause for snoring? The
So I think I already answered this question, because from the nose till the throat. So one by one, the nose, the nasopharynx, the tonsils, and the neck fat, or basically an obese person. If the BMI is more than 30 in an obese person, so these are the anatomical causes, like the causes arising from our body. These are the causes of snoring. There's another cause which is very common among the adults, and especially who are working a lot. So, sleep deprivation. Sleep deprivation can also give rise to snoring. And snoring can also give rise to sleep deprivation. So, it is a vice versa. So, apart from the medical anatomical causes, the other one is sleep deprivation. So, these are the causes of snoring.
Okay, thank you for the information, ma'am. So my next question would be, do sleep apnea cause snoring?
So it is the otherwise. We start with the snoring. So I'll just say what is sleep apnea before I get into it. So, what happens during sleep apnea? The patient has a loud snoring, and then it keeps getting louder and louder and louder. At one point, like the peak of the mountain, the noise stops. It stops for about 10 seconds to 30 seconds, where there's absolute silence in the room and the patient is not breathing at all. So, that is called as an apnea. Apnea is a Greek word which means breathless. So, basically, the patient keeps on snoring and then he's becoming breathless for 10 seconds and then suddenly he's waking up with gasping and struggling, and then he's opening his eyes and looking around the situation, and then takes a large amount of air, gets up, sits, and then takes a large amount of air, and then he starts breathing again. He falls into sleep again, and he'll keep sleeping. Again he'll start snoring, again the snoring stops, again he'll go for apnea, and this is what is the sleep apnea cycle. So I would say snoring is the first step of sleep apnea. It usually follows a long term snoring.
Okay, okay, ma'am. And I would like to just ask for the next question. How we have to deal with the loud snoring?
So basically, if the snoring is loud and the patient and the relatives are restless and annoyed because the noise, they first thing is they have to, if they are a heavy overweight, then they have to start their low calorie diet and do a lot of lifestyle modifications like moving around more, not less of sedentary life and more of working out, just walking outside or going to the gym and doing lifts or cardio or anything. So weight reduction is one. The other is sometimes we see even patients who are moderately built, like they are not very heavy, they are not on the thinner side, but they are okay weight, like, and they also come with snoring. Such people should be evaluated by an ENT surgeon because we need to see inside and find out what is causing them, because the external factors does not seem to cause them snoring. So I think the answer for this question is they can start losing weight. If still it is not going, it is better to seek the help of a doctor.
Okay, ma'am. So from your answer, we can find that not only the people who are obese, the moderate people too have to be conscious
Yeah.
if they are snoring. Okay,
Yes.
ma'am. Then I would go for the next question, ma'am. Do healthy people get sleep apnea?
I think the term healthy, uh, so the answer for this question is no. People who are healthy means they are having a good at least 8 hours of sleep. They won't be consuming alcohol and they won't be a smoker, I guess. And they will be within the desired body mass index, maybe 25 to 30 or less than 25. So, such people, the incidence of snoring and sleep apnea is very less. So, who gets sleep apnea is the entire opposite of the group that I described. People who are maybe software or office workers who tend to have a sedentary lifestyle of 10 hours sitting in a place and working, and they are in the heavier side, and people who consume alcohol every day, and people who smoke. So, all these people are in the risk for getting snoring and subsequently sleep apnea.
Okay, so as you said, ma'am, the people who have the alcohol habits and who work in a extreme long time, they may be getting snoring.
Yeah.
So okay, yeah, thank you, ma'am. And actually, I would like to know, can sleep apnea be cured naturally?
So I think sleep apnea. If sleep apnea comes, which means the patient is breathless, as I said, like for 10 to 30 seconds, that if that stage comes, they have to visit a doctor and a pulmonologist to do a sleep study to see how long are they having the breathless episodes and sort out that. Naturally, cure is only till snoring phase, when they only have a loud noise during sleeping. So that is snoring. Such people, as I said, can reduce weight. So such people, what they have to do is they have to. Uh, I would say it is better to quit alcohol and smoking, but if it is difficult, then you can stop alcohol 4 to 6 hours before the bedtime. That is one. And when you are lying down, you should not sleep flat looking up the roof. You have to sleep on either sides, this side or that side, and or maybe a 30-degree semi-recumbent, like lying on a chair. So that kind of small position changes can reduce snoring. But if the patient has sleep apnea, then the only treatment is to consult a doctor and sort it out.
Okay, ma'am. And is snoring unhealthy?
Yes, snoring is definitely unhealthy because snoring is definitely going to lead. It says that you are giving lesser oxygen because of the obstruction in the nose or the mouth. You're giving lesser oxygen to the entire body. So that's why the noise comes. So imagine 8 hours of sleep, all the organs getting a good amount of oxygen through the blood is very important for the next day and our life. So imagine we are having a less quality of sleep with less oxygen to the brain and the heart. We are in risk of getting stroke and heart attacks eventually. So snoring and sleep apnea is such a serious issue. It definitely gives to a lot of issues.
Okay, okay, ma'am. And does sleep apnea, what does sleep apnea snoring sound like?
So this, I think I told you earlier, there is a loud snoring that keeps on going bigger and bigger and bigger, and at one point there is absolute silence, like as if the motor is switched off. 10 seconds the patient does not breathe at all, and then suddenly he gasps and wakes up and sits up in the bed, and then takes a lot of air, and then again he falls into sleep. Then slowly the snoring starts, and snoring keeps on going higher and higher. Again the sleep apnea comes. So classically this is the tide going up and coming down, going up and coming down.
So, how serious is the sleep apnea, ma'am? How it could be reached to the extreme?
Okay, so sleep apnea can give rise to hypertension, and it basically plays with a lot of essential activities and roles in our life. So when you have sleep apnea in the night, which means your quality of sleep is not good. So the next morning when you wake up, you have a severe morning headache because you didn't have a good sleep in the night, and then your throat becomes very dry because our mouth is constantly open, producing a lot of noise throughout the night, so your mouth becomes dry, and the next day your concentration and your memory gets reduced because you've not got a good fresh morning in the start. Then people become irritable because they are excessively sleepy during daytime, because the night sleep was not good. They have excessive daytime sleepiness. All these are the everyday issues. Apart from this, a long term issue is stroke, which means reduced blood supply to any part of the brain can cause stroke, and heart attacks, that is myocardial infarction, because of reduced oxygen and blood supply to the heart. And they can also become hypertensive if sleep apnea and snoring happens for a long time.
Oh, okay. And ma'am, as you said before, the posture, by the people, those who have a snoring problem, they have to be like lying up in a wedge pillow position. So, does the posture too decides the snoring, the sleep?
So, yeah, if a person already has snoring, then it is advisable that they don't sleep flat. It is either they keep 2 3 pillows behind their neck, shoulder, and the head, and raise their upper body to 30-degree inclination, or they can sleep to one side. They can turn to one left or the right side and sleep. But if there is sleep apnea and the patient is heavy, it means if the patient is obese, then sitting in a chair and lying your head back and sleeping is the best position.
Oh, okay. And ma'am, actually, I would like to know that many people they suggest the mouth exercises for snoring, and we have devices too, like ventilation dilators, and we have wedge pillows. So it is better to go for these devices or to have treatments for this sleep apnea and snoring.
So
So
when we have sleep apnea, there is a study called a sleep study or polysomnography, which is mainly done by the pulmonologist. So sleep apnea is dealt by both ENT surgeon and pulmonologist together. So the moment the patient ends up with the pulmonologist, they do a sleep study which has a lot of 7 8 components. starting from our EEG, the brain, the eye, the facial muscles, and the ECG and everything. So it is run the entire night when the patient sleeps, and we come into a diagnosis of how severe the sleep apnea is. If we say it is less severe, then we can try all these lifestyle modification, weight reduction, and sleeping to one side, lifting the head end of the bed to 30 degree. All these can be tried if it is less severe. If we think it is more severe, then it is either surgery or it is a machine called BiPAP. So BiPAP is the machine I think you were talking about. It gives pressurized air, which can be bought by the patient, kept on the bedside, and it's just pumping pressurized air through the machine into the patient's nose and the mouth with a tightly fitted mask. So what happens with the pressurized air? It pushes the air so that it keeps the airway without collapsing throughout the night. So when the airway collapses, only we have apnea. So when you give pressurized air, force it inside, your airway is open, so you will not have apnea. So that is BiPAP is very good, especially if patients are older and they are not fit for any surgical corrections. Then BiPAP can be done, or there is surgery. Surgery has to be done.
Okay, okay, and thank you. So, thank you so much for providing such informative messages regarding snoring and sleep apnea, ma'am. So, from this live session, we understand that no, if a person is moderate, doesn't mean that they are not capable of getting this snoring problem. So, we have to, before any problem, we have to reach out the doctor first. Then, according to that, we have to work out on a problem. So thank you so much for joining our live today, ma'am. And it was very informative.
Thank you.
Yeah.
Thank you.